Yeah.
I think we've all been shunted forwards 15 years with technology because of lockdown. So I think it's going to be inevitable, Jill, that we need to upskill a bit on this sort of stuff. And you know that Zoom is free within certain parameters, don't you?
Yeah, is it 40 minutes or something like that?
Yeah, I think so, that's right. But to be fair, the actual cost, if you do need longer, it is not going to break the bank, you know, 14 quid or something a month. So I'm going to put you on mute, Jill, forgive me, but that's how we do these sessions, just purely so that, because we've had 30 in before, and if we're all able to speak, it starts to interfere with the sort of presentation side. So I don't know how many we'll get. Sometimes we just get a dozen or so. So what you can do, Jill, is if you put your cursor over my video, you'll see two little blue boxes up in the right-hand corner. One says mute and one is 3 dots. If you click on the 3 dots, and then you can scroll down and pin my video. And then what will happen is my video will become the big one at the bottom probably, and then yours will be along the top. And that's what I'm going to do for the recording, because I'm putting these up on YouTube afterwards. So we've got the Biomechanics Education YouTube channel. So that, have you found it? Hover your cursor on my video specifically, and then top right corner, blue box with 3 dots in. So it's 12 o'clock. We've got Jan here. How you doing, Jan? And we've got Galaxy A80, whoever that is. I think you've been in before. Awesome. We got Brett back. So as always, what we do, Jill, is if you guys if I don't know you, tell me who you are, where you are in the world, and then any questions that you are bringing to today's session. So we had a good old Q&A with Brett and Heather last week getting involved. Piam came along as well. Well, Simon's back. Good to have you back, Simon. I know you were working last week, so good to see you. It was a good one last week, actually. So I don't know if you've watched the recording on YouTube yet, but last week's was a good one. It's worth having a little watch. Jan as well. Whereabouts are you, Jan? So let us know your profession, where you are, and your questions. So I'm just going to give you a few minutes to get yourself settled in. Did you find your little 3 dots, Jill? Did you find it? Just to pin the video. I think me pinning it, does that automatically pin it for everyone else? I'm not sure, actually. Does anybody know that, Simon or Brett? If I pin the video, does it pin it for everyone? Does anybody know? I know it will at my end for the recording, but I think you can.
I think you have to go into those 3 dots and click on that, go down to pin video to get you on the.
Do you have to do that as well, or is because I've done it? Is that it for everybody, Jan?
No, I think it's just for your own screen.
Right. Thank you for that. Much appreciated. So yeah, you can go in and do that. So I need some questions, guys. Brett, personal trainer and studio owner in Aylesbury. So we've got Rabina's up in the north. I'm a Freely instructor and Pilates, I know. Jan. Jill, which one did you do with us? You did a 1 day, didn't you? I think it was. If you type in the chat box, so if you hover over the toolbar at the bottom, and you should get a chat bubble, it says chat on it, click on that, and you'll get a box pop up over on the right hand side. We've got Stacy in. How you doing, Stacy? Let us know where you are, what you do, and your questions. Please, that would be great. Just going to do that so I can see you all. I can't see you all, and that's fine, Stacy. By the way, if you want to stay off camera, there's no pressure to be on the video. We do sometimes do practical stuff. I know Simon was here when we were doing, I can't remember what we did. We did the squat test, I think. Did we do some foot stuff as well? I can't remember now. Jan, Is flexion recommended for disc problems? Oh, Jan. What's your background, Jan? Tell me your profession. Yeah, so Ravina's in Edinburgh. I'm in Freely Pilates. Simon's manual therapy, aren't you, Simon? And then I had you in a running bracket, but you corrected me last time. So Jill, if you just tap in. So Simon, PT, sports massage, that's it. Jill, sports massage therapist, you did the one day. I thought you did in Louth, that was it. With Bev and James. James is now a Biomechanics Coach. And he's running his facilities online. Are you doing that? Are you online, Brett? I can't remember if you said that. You're doing stuff online, aren't you, with your guys? Yeah. Cool. Stacy, where are you? What's your profession? And Jan, if you just fill in that gap as well. Nice to see your face, Stacy. Well, thanks for joining us. And then I'll get into Jan's question. Jan, have you sat in one of these before? Okay. So what you will discover is your question will be responded to with a question. And then Brett, we had a good chat with Brett last week. So let's see what Brett's question is. I had several clients who have had a new and persistent issue with lower back due to COVID working from home. Yeah, me too. Obviously, these will all be taken case by case. Yes, good. But generally, would you recommend dynamic, active, passive, stretch release? Good question. Or postural correction by a chiropractor or equivalent? I love having you here, Brett. You can come every week. So just waiting on Jan's profession. Stacy, if you don't mind, just your profession. If you don't mind sharing, it's just helpful so I know who I'm talking to. Because if we do have chiropractics, podiatrists, clinicians, sports coaches, strength and conditioning, I just know I can tap into you, because this isn't about me telling you what I know. It's about what I'm doing is facilitating a discussion and maybe sharing concepts, because I have a special interest in biomechanics. So my background is sort of 30 years in the exercise world, originally professional dancer, British weightlifting coach, strength and conditioning coach, manual therapist, but I only use a portion of my qualifications because I want to do what I enjoy really well rather than try and do everything. So I have a big referral network that I work with an osteopath, a physio and podiatrists who I utilise on a regular basis. That also means I'm constantly in an environment where I can question them and get their professional opinions and feedback. So that always helps. Is there a level of muscle spasm response where medication is the best practice? Ooh, or best response? If not, what have you found to be most effective? Generally speaking, our hour is just filled. We're done now with Brett's question. Again, we'll case by case. Okay. I was just waiting. So, oh, sorry, Jan, you did say studying Pilates at the moment. Fantastic. So I now understand your, maybe the aspect of your question in relation to flexion and disc problems. Okay. So anybody else joined us? Let me just have a quick look. It's just Stacy waiting on us. Okay. So, oh, here we go. And then Brett again. Can too much mobility for general population be bad for you? Same for stretch, same for muscle tension. Assume relative muscular balance throughout the body. Right, okay, fantastic. So I'll go down chronologically. I'll start with Jan's, and it might start to feed into yours as well, actually, Brett. You don't know what you don't know. Yeah, exactly. And I can think that's the point that I'm always coming back to, which is why I think having a team around you is so invaluable, rather than trying to do everything. And I think what's important, I spoke about this last week, and I speak about it on a regular basis, is rather than having a mate down the road as a physio that you send them off to, is have a system whereby you have meaningful transfer of information. So you literally have a GDPR document, you have clinical clearance forms, and you literally, they would tell you, do this, don't do this, and you would say, right, I'm doing this, what do you think? And with the client's permission, the actual interaction then is not a Chinese whispers of the client's interpretation of what that professional said, which kind of brings me to Jan's point about is flexion recommended for disc problems? Forgive me, Jan. It's a rather big question without it being a very precise question. It sounds precise, but I'm sure you're aware, even in your present training, that I would need far more information before I can answer that question. So to Brett's point about needing to understand case by case, each individual, that question would be unanswerable to be accurate and professional without knowing all the details. So there is no generic answer to that question, because for some it will be good, for some it will be bad. But I think, and please correct me if I'm wrong, Jan, because I'm shooting from the hip, because you're not padding out the information, that in certain professions you will be trained that, let me give you an example, osteoporosis, do not flex the spine is a common one. That's like, and it isn't just don't flex the spine, it's like, oh my God, you must not flex because you have osteoporosis. But again, I think even with those types of conditions, we've got to be mindful that some people with osteoporosis can flex. You need to flex to put your shoes on. So if you've got osteoporosis, you still need to stick shoes on. So it's all about context, Jan. And I think what I would recommend you do to be able to answer your own question is what I'm sure you're already trained to do, is take into account a full consultation, understand the disc problem, which is a very broad term. You can get herniated discs, you can get protrusions, you can get prolapse, you can get posterior bulge, lateral bulge, you can get it pressing on nerves. So there's a whole plethora of things that can be classified as a disc problem. A disc problem could be as simple as your QL is in spasm and it's just pressing your facet joints together, which means that QL has less range, which might be classified as less fluid passing through the disc there. But so you would need a lot more information, Jan, and I think you know that. So I can't answer your question, it's too broad, but I would take each individual, my advice would be with that question, take each individual individually. Don't try and find a generic answer to a problem like a disc problem. Get their therapist's details, get their permission to speak to them, find out the exact medical diagnosis, get advice from that clinician about what you can and can't do with that particular individual. Does that help, Jan? Yeah, because, and I think you know that was kind of going to be my response, right? Because we're all a bit different, and that kind of brings me down to Brett's. I'm going to put my spectacles on. Now I've got loads of text coming up. So I'm going to go down bit by bit, Brett, with your questions. Let me just check. So Sophie, Sean, if you just let me know your professions and any questions, you can add them in. Oh, Jill's, okay, Jan, okay, you're very welcome, Jan. Right, okay. Brett says, I've had several clients who have had new and persistent issues in the lower back during COVID working from home. And he's clarifying exactly the conversation we've just had, that you would take them case by case. And that is absolutely right. We would do all the stuff we talked about last week, Brett, in terms of assessment and consultation, which I know you'll already be doing. But generally, would you recommend? I guess that's the issue, is that statement, general, if we're going to be case by case. So we can't be general unless we understand their history and any problem they've got going on. So until we've clarified maybe one of the causes or some of the causes that may be contributing to their back pain. However, to try and help you with the issues we're all faced with right now, which is helping clients online from home. I know some of you may be a little bit face-to-face, but we're still kind of challenged even in that sense. We can't put hands on people to test them. So it's still basically in person what we've been doing online. So it's kind of the same thing. We've got visual and verbal abilities to do consultations and find out what's going on. I've literally just been putting together a document about, because I did a live class to, it could have been up to about 2,000 HSBC staff globally, Hong Kong, Asia, the Americas, and they were wanting to help the staff from home, offer them something as a gift. And I went and did some I'm Freely stuff. So I had to be generic. I didn't know who they were. I didn't know what country they were in. I didn't know any of their history. It was all done with all that in mind. So obviously precursoring what I was doing with a disclaimer. And then it's about thinking around, depending on what you get from that consultation or verbal feedback, what is the least contraindicated model we can apply that makes sense based on the information we've got. So Brett has mentioned dynamic, active, passive stretch release, and I'll come to the second point there in a moment. So we have a whole series of techniques that we already know: stretching, muscle energy techniques, passive stretch release, you know, all these various versions, and also they can apply to different parts of the body, so the pelvis, the spine, shoulders, knees, etc. So back pain isn't necessarily caused by the back. More often than not, in my experience, it isn't. It is a combination of the things going on below, above, from the floor. And more often than not, what we get is, I could do a whole session on pain, actually. We might do that next week. Pain science next week. Stick it in your diary. And so what we've got to be mindful of is coaching clients how to be dynamic at home that isn't going to interfere with them working, but safe and effective, or as safe and effective as you can get. So one of the muscle energy techniques that I teach, which is known as post-contraction sensory discharge in the research world. So there was a guy called, actually I think it's a lady, called Rebo Siskar, who did some research into submaximal endurance static holds, isometric holds. And they found that it was a really effective way of improving the function of a muscle. If I said to you, submaximal endurance hold, you're going to say to me, how hard and how long? So the research we did over 25 years with high-end athletes and general people, general public, was a 20% muscular effort of isometric contraction held for 20 seconds. And that gives you your submaximal endurance hold that they were talking about. And we have, and I have professionally over 16 years of using it, found it is extremely effective, particularly where more aggressive techniques like stretching, which might not be perceived as aggressive, but if you're being dynamic, then being dynamic holds more risk than being static in some ways. So a static 20% muscular effort endurance hold is obviously going to seem, feel, and be perceived as much safer than getting a client you don't know who has back pain to touch the toes, or I don't know, whatever else, do a hamstring stretch, for example. I'm not saying you shouldn't hamstring stretch either, but just as a kind of a pyramid, if you like, of the least contraindicated. So personally, I would always start with muscle energy techniques. Now, a muscle energy technique you may be familiar with is PNF. Now, muscle energy technique is just purely a contraction where the origin and insertion of the muscle are being statically brought together. Does that make sense? So it's not a dynamic, it's not an isotonic contraction, but the origin and insertion are through a static resistance being engaged, or the muscle is being engaged through a static isometric contraction. PNF is again more aggressive than the 20-20 technique that I've just described. And so it's looking at all variations of intervention that you could apply safely and effectively and confidently as a practitioner while they're at home. Just to add into that, if there are no red flags, Brett, if you feel that the consultation hasn't brought anything that you're worried about, but they're miserable because their back's sore, they're sat at home, you will, in that state, usually you'll get one or two things. You're either in too much pain that you don't want to move. That to me is a red flag. Or you're so uncomfortable, you just keep fidgeting and you kind of feel like you want to get up and move around. So it's how do we create a dynamic workstation that they're able to work from? And I've literally just designed, I'll read you my list. and then I'll send you all an invoice. Just kidding. Dynamic desk program. So I don't know how much you follow me on videos, but I did this over a few days. Are you familiar with the squatty potty? Go to YouTube, type in squatty potty, give yourselves 10 minutes, have a giggle. Conceptually, having your feet elevated when you sit on the toilet, that gives you the ability to squat deeper on a regular basis without having to do anything different or spend any time practicing squatting outside of when you go to the toilet. But if you have books, a small child's stool, you know, the step-up stool they have to brush the teeth. I've just got one of those. It was £1, I think, from IKEA, and other stores are available. The squatty potty is probably a bit more expensive because it's a product. Books, a block, anything in your toilet, that means when you sit on the toilet, your knees are above your hips, means that every day on a regular basis, you're going to be squatting ass to grass without any, you know, perfectly safely in an environment where your inner pipes will actually have a better flow as well. So the squatty potty is a no-brainer. Get a squatty potty, buy a kid's little stool, add that in. Another technique is to avoid sitting on the sofa in the evening. So we're in this environment of being more comfortable. Now, comfort means you are likely to move less. Now, I don't mean you should be uncomfortable, but I would suggest in the evening, instead of like sitting on the sofa, lie on the floor. If you lie on the floor on a mat with cushions, you're going to move more. You're going to be more dynamic. I'm actually more uncomfortable now if I sit on the sofa because I end up just sitting. Whereas if I'm on the floor, I kind of walk, I can relax, but I'm moving around constantly as I'm lying on the floor, putting cushions around. So there's another tip. When you're in the kitchen, and these are designed, Brett, to avoid having a whole other exercise plan when you want to be doing your dynamic stuff with them. So these are just tips. When you go in the kitchen, don't bend over, and you would teach a client this, don't bend over to go in the cupboard, squat down to go in the cupboard. And again, that would come to your coaching to teach them how to do that. Every time, or you might have a door in your house that when you walk through it, there's a sticky note on the door that tells you hang from the door, and you reach your fingertips over the, what do you call it, around the door, and you just hang for a minute and you let your shoulders and your scapulars lift out the socket. And you may just do that each time you walk through it, maybe just one door, not every door, or you'll be hanging around too long. Dynamic desk posture. I've actually just made a video of me at my desk. So I don't know if I can show you. I can't show you, I don't think. So I have boxes and books and things, and I keep changing the height of my keyboard. And I might stand, and then if I'm sitting, I lean forwards, I lean back, I twist, and then I might kneel on my seat, and then I might put my keyboard on the chair and kneel on the floor, or squat on the floor, so that they're permanently changing position. And obviously they make choices on which ones are relevant. The other one is whenever you're on the phone or reading an email, stand up and walk. So if you're having a business conversation, then get up and walk. So literally your alarm is your phone rings, right, stand up, get away from the desk, walk. And then maybe have an alert that goes off, I don't know, every hour, 2 hours, whatever is reasonable, where you literally get up, run up the stairs, run back down, carry on working. And it's like 20 seconds, or run around the garden. So that's going to be client dependent, Brett, and I know you understand that. Clients with back pain, as long as they are cleared to be within your coaching program and there's no red flags, they should be able to do that stuff. Anybody can't do that stuff, I'd be questioning how much pain they're in or how much lacking movement they have. That might end up being a red flag if they really can't move. So key questions are, does movement feel good? If movement feels bad, that's a red flag. If movement feels good, fantastic, I've got some tips for you. And you list those kind of tips. And they might do one a week. They add one in each week, which then doesn't feel like a huge amount to remember. and then each session you coach them on with your personal training. You say, did you hang off the door today? Oh yeah, no, I remembered, but I forgot. And then gradually you're helping them break in new habits. That will all travel through when we get back to the big lift in lockdown, which is going to be a while yet, but like over time, and even into their desk world. So even when they get back to an office, all those tips will carry on through and generally keep them more dynamic without stopping them working. They're all fundamental movements that they're going to need to do. They're not exercises. So they should be the most appropriate. Does that answer that question so far, Brett? That first question. And then you've asked about postural correction. Sorry, I don't mean to laugh. Any chiropractics in here? Any osteopaths? Any clinicians? Let me just spin through. Martin, what's your profession? We've got Sophie, Stacy, Luke, and then I think Sean's told me what he does. Let's have a look. Yeah, Sean's a PT as well. Just let me know what you do, guys. Any clinicians, so I can use your skill set. Just as an aside, by the way, chiropractics, physios, osteos, people always say, which is the best? It isn't the profession, it's the professional. So a professional who's open-minded and willing to talk to you and work with you, they're probably going to be good at what they do. Those who are quite close-minded, maybe a bit old school, and you struggle to develop a reciprocal arrangement with, maybe of a different set of values and ethoses, I will say. So just to waylay that in your question, so I'm assuming you work with a chiropractor, do you, Brett? Have you got someone down the way? Right, brilliant. So I'm assuming they're going to be good too, brilliant. So postural correction, and I'm not going to spend too long on this because this is an entire Q&A in itself. If you think about postural correction, it's a bit like, you've heard of the term anterior tilt. It gets chucked around as, oh, I have an anterior tilt, or bad posture, good posture. What I want to do, and this is again another opening up the layer, and if you allow me to just, I'll layer into what I'm trying to say here. You are all in a posture now. If you now move, you'll be in another posture. And if you move again, you'll be in another. Every position of the body is a posture. Postural correction without evidence-based individual joint analysis, system analysis, is a subjective collection of all of your joints and systems in one position. And I think it would be problematic to assume that we should all have a certain position in our pelvis to have a good posture. And what I mean by that is, we all have an anterior tilt. If you stand and push your bum out and extend your spine, your pelvis will have tilted forward. So we all have one. It is not a diagnosis. Bad posture, good posture, I think we've got to be careful. It's the interpretation of it that runs the risk. Somebody who has a certain, are you familiar with anteversion, femoral anteversion? Have you heard that term before? So if you imagine your femur, have I got a pelvis? Hang on. If you imagine your pelvis, and this is the femur, and there's your greater trochanter, and the neck of the femur here, and it sits in your socket like that, okay? So a genetic design for some people is that they are anteverted or retroverted. So a normal position would be here. An anteversion might be here. A retroversion might be here. So if you imagine having a femoral anteversion, so your femurs are genetically, structurally in a different position, how is that going to affect your posture if we're using posture as a measure? So, and this spans down into teaching the perfect squat, yeah? The only perfect squat for me is the one that my body is designed its geometry is designed to do. So let's be careful about the use and the interpretation of posture, because it's subjective. It is useful, don't get me wrong, we can use it. I'm not saying don't use it, but a posture, for example, a common posture we talk about is round shoulder, yeah? Sort of desk work round shoulder. So let's just take that as an example to just help out with this point. What can cause round shouldered posture? What would be the cause of that? Sorry, not an extrinsic cause, an intrinsic cause. Is it the shoulder? Is it the spine? Is it the muscles? Is it the nerves? You tell me. What do you think? Tell me what you think causes a round shouldered posture intrinsically. Okay, Stacy, thanks for that. Welcome. And I'll wait for your answer. I'm just reading through some of these, so excuse my gourmet face. Tissues in my face. Yeah, that's right, Rabina. Jill just started jogging. Okay, I'll come back to that question in a moment. Sean, one of my clients has past shoulder impingement through training with me at the gym, became pain-free. Good, well done. But now during COVID, still training at home, has had some pain come back. Right, okay, so yeah, whatever you did for him when you were face-to-face, Sean, sounds like the solution on that one. That sounds quite an easy one, mate. Let me know if there's any more detail I need from that. One back pain client. Someone keeps ringing me. One back pain client, few specifics, female ex-amateur hockey player, mid-50s, now sat at her desk at home, or a soft desk chair. I think doesn't leave her chair for 10 to 12 hours. She needs that stuff I've been talking about when cleaning the toilet. She needs to sit on it with a squatty potty. General pelvic dysfunction. Been trying to increase ab strength and rebalance the tilt she has. Right, okay. You're not going to change a tilt that was going to happen normally when you sit. Your pelvis will tip back. That's a normal thing to happen. I think what you mean is to reduce the impact of long-term posterior tilt. Is that what you mean, Brett? In here, this is our first question. Lower back as you went. Yep, got you. Luke, PT rehab, Martin rehab, Brett. Does it boil down to function, comfort, pain, management, muscle imbalance? Okay, right, I'm with all that now. Brett, me and you need to have a one-to-one, I think. Jan, tight pec muscles could be a cause. Stacy says weak core. Jill, weak back muscles. Simon, muscular tight soreness. Luke, could it all be a combination of joint shape, muscle imbalance, time spent? Yeah. Luke, yeah, absolutely. Because what you're saying, Luke, actually, you're collectively saying what everybody else is offering as ideas. So you're all right. So that's what I'm saying about the problem with posture analysis and postural assessment, because that can be caused by pec minor, protracting, pulling your scapula forwards. The knock-on effect of that is then it's pulling and holding your thoracic spine in flexion. You then get tension down the median nerve. And they're just a few things to give you examples of 3 different structures. So you've got muscles, joints and bones, and nerves, that come together, and they, Sean, absolutely will affect the breathing mechanics. But what causes faulty breathing mechanics? So we have to put all this together and recognise posture assessment is subjective. And to take plumb lines, which is what it uses, my understanding is, like, you take a side-on view, you see where the shoulder's positioned, you see where the ASIS is in relation to PSIS. The problem with that is we have to always have in mind we are as different on the inside as we are on the outside, and we're all designed differently intrinsically, from our history, from our limb length, our genetics, our geometry, our injuries, our sports, our exercise programs. So to purely use postural assessment is subjective and potentially will result in an assumption about what to do. So that's where it comes right back to Brett's original question, which relates back pain to the posture of sitting at a desk all day. So it kind of all interplays with the idea that what we should do is we can use posture as a benchmark. So I'm sure you've all seen or done those photographs before yeah, where they're in their pants or whatever you like to do. And then you do sort of 6 months later and they're nice and slim in the pants in the same position, and their shoulders might be further back, the tummy's a bit flatter, or whatever it is. And you can do the same for biomechanical analysis. So you get them to squat or deadlift and you watch their position, and that's what you do. You do that all the time. You're all PTs or exercise movement professionals. So what you will always be doing is a visual biomechanical analysis of their extrinsic performance, and you're trying to work out why they're moving in the way they are. So in a very long-winded response to your question, Brett, have I kind of given you some ideas on that? I think you and I need to have maybe some one-to-one time, because I mean we could just go on forever, but to be fair, if you want to come back every Wednesday, we can share it with everyone else. I could talk to you all day, mate. So just coming back down to any of the other ones. So I'll just come down to Jill's. Just started jogging and my medial gastroc tib posterior keeps tightening up after 10 minutes into the jog. I think it's weak. How could I focus on strengthening it, please? So Jill, forgive me. Let me see where you are. Just pull you up in my video. There she is. I can see the top of your head. So Jill, you've got your video off, Jill. Again, what we've got to be careful of, Jill, is, and I don't want to for a minute undermine what you're saying, because you know your body better than I do, but you're assuming that the weakness that you feel requires strength work, and I would suggest that may be an issue. So a common cause to think about is tension through the nervous system. Most of us have too much tension in the back of the calves, or when you go into dorsiflexion, there's tension down the back of the heel and the calf, maybe the back of the hamstrings, and it can be a combination of things, as I've been saying all along. But very common, a part that usually gets missed is the nerve. So if you go back, Jill, to the YouTube channel, I think we did it was it about 3 weeks ago, Simon? I think we did the nerves, didn't we? Go back to, not the last week, but the week before. I think we covered the nerves. So I taught you in that video how to test and mobilize your nervous system. And I think that would be a good start point, because what you'll see is, and again, going back to what Brett was asking earlier, the safest, least contraindicated methods coming in first, which are very slow, static, controlled techniques, are always going to allow you to, if that's the only thing you're adding in and then your calf feels better, you know it's that, rather than doing strength work that may make you more uncomfortable. It's difficult in a flipping 1 hour conversation here. I could elaborate in all sorts of directions. I think where I need to get to, Jill, is don't assume it's strength or a lack of strength. Don't assume it's weakness. If you feel tightness, the question is what is causing the tightness, or what could be. I would suggest not only the muscles, but tension in the nervous system is definitely one to have a look at in those things. That's just from my professional experience of working with athletes, is that the nervous system often gets missed. So go and mobilize your nervous system, use the muscle energy techniques that you learned with me on that one-day workshop, and have a professional keep measuring you and assessing you. I think it's something we should all invest in our own coach. Do you guys have your own coaches or PTs that you go and see? Do you hire someone to look at you? Martin, do you have a PT or a coach? Yes, no? Yeah, you do. Luke, do you have one? No? Okay. Brett, have you done in the past?
I do a skill swap with Heather, my other PT. So
yeah, perfect. And I think that's the smart way to go. One, you're going to get an unbiased assessment of your own body from somebody else, because you are biased, by the way, about your own body. And while you may know a lot, actually, somebody else might come up with something that you'd never even thought of. It also gets a second opinion on everything, which is good. I think we should challenge everything we're told or we're thinking, which is quite hard when you're in your own head all the time. And it's hard to know what somebody else thinks, to have that to back and forth. So I would do exactly as Brett is doing. I'd swap skills. So it might seem a bit odd to get a PT when you're a PT, but the most growth I've had in my training is when I've had a coach. I am a strength and conditioning coach, but when I went, I think it was on my second session with Stephen Aish, who is, by the way, if you're not following Stephen Aish, go find him on Facebook. The dude is an absolute, he's a god, he's fantastic. I did 10 PBs in my second session with him on all my Olympic lifts. So I did a PB, then I did another one, then I did another one. I was like, and he wouldn't tell me what was on the bar, basically. But I would never have been able to do that on my own. He was there coaching me, you know, a few one-liners, and it's invaluable. While they're quite technical lifts, even with just somebody watching you, you could set up a video, but it's not the same as somebody there while you're squatting saying chest up or whatever it is. So I think I agree with Brett. I think to get a coach, so Jill, if you haven't already, you don't need to pay for it. You can offer them your own service and hopefully find somebody. So Sean, your guy with the shoulder, let me just come back to see if you've responded actually before I do. Yeah, so Sean, it might be, I think if you've helped him out of pain when you've been with him face to face, now that he's got it back at home, what's changed? Is he doing what you did before? Is he not? Kind of layer that back in and then see if that helps, I guess. And then Brett, you hockey player, I think we've gone through that. If I've missed anything, Brett, let me know. Does it boil down to function, comfort, pain management? Yes. I just found, I got one up in case I didn't get any questions, but with Brett here, I don't need to use my PowerPoint backup because he asks really good ones. And I've got a presentation I'm going to do. I think I'm going to do a webinar, maybe an hour, on function. What is function? What is functional assessment? What's the point? And what is the paradigm of functional training to challenge it as a concept? I like to challenge everything. I like to encourage you to challenge everything that I'm telling you, that the books tell you, that your mentors tell you, and any educator who is worth their salt will be open to being challenged, because the idea is not to dictate, it's to try and create autonomous learning by giving you ways of thinking or alternatives to the way you think, which is your paradigms. And where the industry up to now has been quite spoon-fed. I don't know how long you guys have been in the industry. I've been in it 3 decades, and you know, everything was isolation. No, you can't. You've got to be functional. Isolation shit. And now we're going back to isolation. And you know, you have these trends where one thing's fashionable and then it's not, and then it comes back again. So there's room for everything. I think what we need to do is, when we've got a client with these kind of issues that you're talking about, how do we take all the stuff we know and maybe challenge even what we're doing on a regular basis and think, is that the best thing? What could be causing that? How much more could I do? And I guess that's where these kind of CPDs come in. And with lockdown, I think we've all been on a massive learning journey. We've all had that bit of time, haven't we? And all the education companies have been going, have a free sample or cheap CPDs. And so everybody's been on that learning process, which is great. But I think it's important, even as an educator, to say to you, I don't have all the answers. I'm not the smartest, professional out there. I've got a limited amount of experience. But I think if we can talk about paradigms that the industry is heavily influenced by, we all need to be functional, then we should challenge that. Because what is truly functional right now? This. So maybe we should have little dumbbells on our fingers to train our fingers while we're working at a keyboard. I mean, let's really challenge it. Should we be training our clients to sit at a desk? I'm not saying we should. I'm just trying to be critical about, we kind of tend to, you do a load of education, your brain gets fried, you layer it into your system, it works, so you go, great, I'm going to save a bit of money now and just use my system. But we should regularly go on these CPDs, go along to new training, learn new concepts, and maybe challenge everything we're doing and go, right, I've helped these 10 clients, I haven't helped that one. Why is that? What else could I mean, don't beat yourself up, guys, you can't help everyone, but conceptually, is there more? What more? What was wrong? And it may not be a skill. It may not be you. It may be them. It may be the way you engage. It may be communication skills. It may be the style of your system. It may be finances. It could be a whole plethora of things. So, right, let's go back to here. Luke, could be a combination. Yes, I think we've covered that. So Luke was right. Brett, am I right to say weak strong is too subjective to the imbalance? Probably. And it should be labelled as an imbalance. I think if we define words, and this is again peeling back an extra layer, Brett. So if you take the word weak, like we did this last week, if you take the word weak, W-E-A-K, and then you think about the definitions or the things that can make you appear weak. So weak doesn't just mean not strong. A weakness can be apparent, like Jill's tight calf, that may not need strengthening. It may need the nerve mobilizing first. A pain in your back may be perceived as a weakness, but you don't want to strengthen a weakness that might be an asymmetrical position of your spine. You would want to address that first. So the definition of weakness is what we need to challenge, and then the definition of strength. Strength, again, you know, we might think of that in kilos, but you might think of strength in endurance. You might think of strength in Ethel with a Zimmer frame getting her potatoes from the supermarket and back. That we've got to conceptualize it and understand all of the things that might help us define it. So even muscle imbalance, what would cause a muscle imbalance? It could be any of these things. A muscle may cause a muscle imbalance. The antagonist may cause the imbalance with the relationship with the agonist. The nerve may cause a muscle imbalance. The stiff joints, or a combination of all of these. A poor movement pattern, a different length femurs, a metal plate in your ankle. So I think the concept you're getting to, Brett, is what is the paradigm of what you're talking about there is the answer, rather than a straight answer to that. To subjective, I think it's trying not to label things, which is difficult. And I think this is where the challenge as an educator is talking to you from a technical perspective, and then how do I translate that to Barry at his desk working from home? Because you then got to go back to your arm, your bum, your leg, and conceptually they're like, well, I don't know, what does that mean? And so there's this transition of communication that makes it challenging. So I think language is always going to be ambiguous, Brett. I think the industry is rife with it. And I think that would be the thing I would ask you to challenge the most. And even I slow down and try and think about what exactly am I saying here. And that's why I feel my head is slightly ahead of what I'm trying to say, because I realize I'm talking to you guys and you wait to hear what I'm saying, and I need to try and help you think differently rather than give you my opinion. And I try and say when something's my opinion rather than when something is, I'm trying to just encourage you to go away and conceptualize something. So if that maybe helps with that point. Sean, faulty breathing mechanics could impact, I think that was in relation to the posture, but I would imagine that the root causes of that round shoulder posture could possibly contribute to your breathing mechanics being faulty, if that makes sense. Is it a case of creating a hierarchy of issues with a general idea? You always need a system, Brett. And if you're not following a system, then everything's chaotic. Let's try this, let's try that, let's try this. That's where the chaos comes in. So what we talked about last week was systematically working through the body. So that might be one system. So let's focus on getting your pelvis moving better first. Let's try muscle energy techniques, see how you move. Let's try nerve mobilization, see how you move. Let's try joint mobilization, see how you move. Brilliant. Next, we're going to go to your spine. Systematically, nerves, muscles, joints. And so it sounds like a long drawn out process, but hey, that's why they're paying us for systematically enabling each part of their body to move better. And it's not your whole session. That might be a little bit of the warm up. And then you do your boot camp or your strength session or whatever it is on top of that. But over the weeks, you will be systematically visually assessing, documenting, videoing, and seeing them progress. So that would be the general side, is have a system. If you haven't got a system, you'll be all over the place. That comes from your SMART goals and your pyramid of training. Prepare them, give them the capacity, give them stability and control, and then get them functioning well. And that might happen in one session, or that might happen over the weeks. It will probably happen in both. You do your warm-up, you do your prep phase, your muscle energy techniques, your nerve mobilizations, your joint moves. Right, let's get you strong and stable. Let's start with a squat maybe, and then we're going to go running, or I don't know. You know, there's several ways of kind of defining all of that. So yeah, definitely have a system. Right, okay, Brett. In response to Jill's question, would it potentially be a case of introducing lower level endurance conditioning? You could do. But again, it's about understanding what the causes of the problem first, and maybe even writing a list of the things that could contribute to the tension in her calves. One of the problems with your comment and Jill's is you're both assuming the calf is a calf problem. Sorry, the calf problem is caused by the calves. And it could be something up in the spine. It could be anywhere in the body. The body is an integrated system. And so understanding that should broaden our thinking around how we have a system, addressing their movement issues. Don't assume that the calf problem is caused by the calf. It might be, but it may not. And in my experience, more often than not, it isn't. Simon, who's your biomechanics coach, Simon? Amazing. Jill, Simon. Stephen H. Sorry, Brett, you said, what was his name? Is that your biomechanics coach? Question there. In regard to the squatty potty and aiding squats, would it not be an idea to suggest to clients sat behind a desk to also elevate the knees above the hips? Yes, we talked about that. Or would this be? So I think to come back. Oh, Alex Moore. So you're down that neck of the woods. Is he still down there? Oh, hang on, where's Simon gone? Are you still down there? Down the bottom? Oh, right, okay. Send him my love. So Simon is talking about if at the desk, can we elevate the knees above the hips while they're sitting there or would it be detrimental being in that position for too long? Any position you hold your body in for a prolonged period of time can be detrimental. Your body's designed to move. You will notice I have not stood still. I'm a fidget pants, and that's not necessarily a bad thing. I've always been like that, by the way. I can't change it. But being a movement nerd and understanding the body is designed to move, any posture you hold for long periods could, over time be detrimental. So there's no reason why you can't sit like that, Simon, but I wouldn't sit there for a long time. I would keep altering position, which is why I have all things around, so I can very quickly squat down or stand back up or lift my hands or alter my height, my position. And so it's being dynamic that's the key rather than the actual position. I think most people might struggle with that position in the early days until you've worked with them for a while, got the hips moving well, given them more dorsiflexion, knee flexion, hip flexion, etc. Brett says, the coach you recommended that you use, you said, no, he's not a biomechanics coach. So Stephen H, Stephen Aish. He isn't a biomechanics coach. He's my strength and conditioning coach. And if you go and follow him, he's a very, very, very modest genius. He's a kettlebell strength. He's just phenomenal. He's in his, I don't want to do him, he's a mid-40s, 3 kids, family man, and he was preparing for the Japanese Olympics to be the fastest veteran in the world. The guy's fantastic, and he does a lot of great quotes. Very, very zen guy. He has close relationships with Thailand. Jill says, think it was neutral trainers and ankle position that highlighted the calf issue. Right, okay, brilliant. Thank you, Jill. That helps me respond further to the point you made earlier. So, two things. I'll do you very short in a nutshell, and then I'll point you towards a video. When you have new shoes, any new shoes, they are going to alter the force production going through your system. And so you can, for a period of time, find that the tissues or the structures above may feel uncomfortable. That may be a good thing or a bad thing, and I don't know. I'd have to assess your feet and everything else. But anything that alters the force production when you're running, which is new shoes, may for a time make you feel uncomfortable. So that might be the reason. It's whether it's a good thing or not. It's whether they're the right shoes, whether your body was ready for doing whatever distance run you did in them, or the speed you did in those new shoes. You may have done too long a run and your body wasn't ready. I think you said it kicks in early though. I can't remember. But yeah, they could certainly have an impact. So off the back of that, if you go to the YouTube channel, where there's loads of free stuff on there, by the way, I did a live interview with a podiatrist, Sam Chidwick, who he's in Birmingham somewhere, I think. Fantastic guy, very modern thinking, and he can enlighten you, Jill, a little bit more about shoe orthotics. I think we're gonna have to do another one because like Brett and I, Sam and I could have talked forever about understanding human movement and biomechanics, and then the intervention of shoes and orthotics. So he is a podiatrist, and so having his input was phenomenal. Very open-minded guy. So if you're anywhere around the Midlands, go check him out. I think his website, or the company he works for, is Superfoot, SUPA foot, www.superfoot.com.co.uk, one or the other. Anyway, go and watch the video. It's about an hour, just over, and very enlightening. I was coming from a Biomechanics Coach perspective. He was coming from a podiatrist perspective. And while I was challenging him, I loved his answers. We were on the same page. So very welcome, Jill. So we've got about 5 minutes. So I'm aware that some of you didn't ask any questions. If you have questions, we can do this again next week. I might do pain science next week. Do you fancy that? Pain science. So we'll do an hour next week. I'll talk a little bit in my minimal knowledge about pain science. And I've got a really good, some recommendations for you as well. In the meantime, if you've got any questions, feel free. You can find me on Instagram, Biomechanics Education, Facebook. We've got the YouTube channel, Biomechanics Education. I'm putting loads of free stuff on there at the moment as well. We have now got, I'm just trying to help guys, by the way. I've got a lockdown bundle where you buy one workshop, you get 9 resources. So I'll pay for your year's Simspa membership. You get 4 workshops on that one. I'm just trying to help out. So tell us what you want. Tell me what helps. These free Q&As seem to be helping guys who are really stretched. So I'm trying to offer, free, low cost, online. We'll be hopefully going back to face-to-face. I'm planning from September-ish, but I'm prepared it might be next year because what we teach is hands-on. But it might be we can go back with gloves and PPE stuff as well. I'm not sure. So, Simon, could I ask on Brett's question of what is the most common mistakes PTs do? Is that a question to me or to Brett? Sorry. Oh, sorry, Brett. I missed a question, did I? Definitely nudge me back, Simon, because what I'm trying not to do is for about 5 minutes to just go. So I'm trying to read it and talk to you at the same time. So the question was, what is the most common mistakes PTs do? Is that the question that you wanted to ask? Where's Brett gone? Is that the question, Brett?
Yeah, it was, like I said earlier, I think I put, I don't know what you don't know, and it was underneath that. So yeah, you don't know what you don't know. In your professional experience, what are the most common mistakes you see PTs doing when working with clients, generally?
I'm not sure that PTs make mistakes. Every PT, when they're doing what they're doing it because at that time they think that's the right thing to do and that's their level of training. So at that point, they don't see that as a mistake. So I think it would be unfair to say it's a mistake. So I think it's about where you are in your training learning curve, because you know when you qualified as a level 3 PT, you knew naffle, right? Because the minute you came out and started working with human bodies, you go, hang on a minute, they're not moving in the way I thought they were going to move. When I came out of my training, I thought everyone's knees were going to be here, their back would be here, and they would beautifully squat when I just said chest up. And it doesn't happen. You understand what I mean? Like in that layer. So it's a layered learning. No, Simon, in response to your question, if you went straight in at level 4, conceptually, your brain's not ready for that level. You have to learn in layers. So when I was a level 2 gym instructor, I was asked by members at my gym if I would PT them. I said, I can't PT you, I'm not insured. She said, yeah, but I want you, because I was just talking to them all the time. It doesn't mean I can't help, but you've got to think about where you are in your journey and what your insurance covers you for and all that stuff. I'm going to try and answer your question in a moment. So I think, if I was perfectly honest, the biggest mistake I see PTs make, and this is usually very early on, is they think that that's it. Right, I'm a PT now. I think that's the biggest issue, and because what will inevitably happen, as you all know, is you start working with bodies and you go, I actually don't know anything. I need to go back to my anatomy book. I need to go on a course. I need to learn about nutrition. I need to learn about movement. I need to learn about psychology. So I think, if I was being honest, the biggest mistake would be to undervalue good education, but to I know what you mean, though, by common mistakes. From my professional background as a movement specialist, biomechanics sort of area is my specialism, is trying to force someone's body to do something it's obviously not designed to do. For me personally, that would be where I would want to dive in. I mean, I don't, obviously. That would be unprofessional to try and dive in and tell somebody else how to work with a client. But I think just saying, push your knee out, come on, chest up, come on, when it's clearly not going to happen. Their spine's too stiff, the pelvis isn't moving well. But I'm not sure that that's the PT's fault. I think that's at that point, they think that's what they're trained to do, is encourage them to get their back straight. But if their back is used to sitting at a desk all day and it's too stiff, it doesn't extend, they don't necessarily have the training to test and do a preparation piece outside of a 5-minute treadmill warm-up to prepare them to squat, if that makes sense. No problem, Jan. I know I'm going over because Simon, Brett and I will probably be here for another half an hour. No, Simon. So PT education, I don't think there's anything wrong with PT education. I think that, I'm going to give you my opinion now. I'm running the risk here. I'll give you my opinion. In my opinion, I don't think that a level 3 PT should get insurance to work with an individual. Let me explain that. If you think about all the bodywork practitioners, and so I mean physios, chiros, surgeons, doctors, PTs, everybody collectively, anybody who works with the body, we PTs are the least educated in our compulsory base level education. If you look at all the others, they have a 4 or 5 year degree, they've had a placement, they've had mentors, they've spent 2 years on an NHS ward. We haven't done any of that, and yet we're the first person a client will see in a gym, and they'll see us 3 times a week. They'll only go and see those guys when they have a problem. So I do believe strongly that SIMSPA are going to start changing this. I don't think they're going to do what I've said, which is stop you getting qualified and insured at the level 3. I think a good idea in the future would be level 3, you are in a probationary period where you can be insured to work with people, like a level 2 gym instructor, if you like, with people to a certain level. Underneath maybe a level 4 or a chartered practitioner for a period of time, after which you've got some more CPDs or whatever it is. and then you get a level 4, and level 4 gets insured. Because level 4s, by the way, I think every PT should do all the level 4s. I'm not saying you should, but we should all know about obesity, mental health, low back pain, all of the level 4 qualifications should then be a qualification that elevates us to a level where we get insurance, and then we might be perceived as more on a hierarchy of a straight line with the other body practitioners than being down at the bottom. And we actually have a bias to ourselves being down here as well. We put ourselves down here as well. Our clients do, and we do. Oh, I'm not a physio. As if the physios are going to be better or smarter at exercise. So I think I'm just trying to kind of, from a bigger picture perspective, something I'm heavily involved in is trying to understand you guys. My biggest passion is helping you, to help you feel more confident, have more skills to help more people with all the physical modern ailments our clients come to us with today. We don't have bodies that we had 30 years ago. How many clients have no issues? Hold your hands up with the fingers of how many clients you have with no issues. Yeah, so Brett's got none. Simon, yeah, Jill's got none. Yeah, it would be very few. Yeah, they're all going to have, oh yeah, just a bit of a shoulder, but it's fine. Oh, I had surgery on me. Oh no, but it's fine. So it's like, it's normal. It's not normal, it's common. So our skill sets need to reflect the physical modern ailment requirement of our clients coming to see us now. We're not replacing physiotherapists. We're not replacing that. That's different. I can't think of anything worse than working with the injured. Just does not fill me with joy. I want to work with people who want to move better. They've got these low-grade niggles, you know, things that common issues. They're the guys I want to help. So there is still a big difference. And in all of those bodywork practitioners, we are the exercise experts. We're the most qualified and experienced in prescribing exercise over all the therapists and the surgeons and all those, unless they've got an exercise qualification. And the government is telling everyone exercise is the answer, but we're the least qualified. Hang on a minute. It's not all jelly. So I would point you in the direction of CIMSPA, which is the Chartered Institute for the Management of Sport and Physical Activity. If you have not checked them out yet, they are going to change our industry. I would look at what they're bringing out, the chartered status. You've heard of a chartered physio? You can now be chartered. Not yet. They were going to launch in April, but they've had to postpone it. What does chartered mean to us? You can all become chartered through CIMSPA as a member, as an exercise professional. You cannot be chartered the day you qualify. So one of the problems with the levels, there's a level 3 PT qualified 30 years ago. Someone qualifies today. On paper, they look the same. That's a problem. So what the chartered status is going to do is separate them. If you're brand new, you cannot be chartered. You can only be chartered when you have enough evidence of good practice, success stories, testimonials, references to provide to apply for chartered status. And then to keep chartered status, you need to keep providing evidence of good practice. So if you become chartered, we will over time collectively start to be raised up in how we are perceived in the nation as body workers. So I definitely go and have a look at CIMSPA because they are, I mean, I'm a massive fan, honestly. They are what I've been in the industry a long time. I've seen what Reps did, which was a great start. We didn't have any standards but before that. In the first 15 years I was trained, you did whatever you want. Yeah, I'll train you. Oh, don't worry about that. We'll just do some mobility work. So it's going in the right direction. The more of us that get on board with CIMSPA, apply for chartered status, the quicker we will all be starting to recognise on a hierarchy level rather than a pyramid scale where they're up there and we're down here. And then we can be proud of what we're doing to help the nation move better. Does that all make sense, guys? Simon, I appreciate opinion from someone working in the industry for that long. Wish I had more intense education when I started. Dude, honestly, Simon, I'm non-academic. I've never been to university. I've done more reading than I have courses, maybe. I've done a lot of courses as well, but my actual qualification repertoire is probably not much different to you. I do make people's ears bleed. I do speak a lot. I do what I love, and I put myself in situations where I'm surrounded by people I see as smart. I ask them, I email them, why are you saying that? What's going on? Why? How is that? How does that work? Because I want to understand it, because I'm not that fast. I'm not a natural academic learner. So I have to ask loads of questions so I can eventually understand it. And it's usually like 3 days later when I'm out for a jog and I go, oh yeah, femoral retroversion. Ah, right. Oh yes, that means. So it takes me a while. Stacy, in order to help me gain more confidence as a Pilates instructor with the body's movement and how to notice spot misalignments and improve someone's issues, do you have any resources to recommend? I have a whole portfolio of education I can sell you, Stacy. That was so shameless, wasn't it? I would find, there's a shed load of books. I should do a book list, shouldn't I? I have got one somewhere. It's not a simple resource direction, Stacy. If you're still doing your training, finish your training. Who are you training with, by the way? Ask your trusted mentor who they recommend from the Pilates world. For you, Stacy, I would go and follow Tom Waldron, who is a Pilates teacher. He's also a master trainer. He's one of our Biomechanics coaches, but he specialises in Pilates and he communicates beautifully in Pilates world language. Tom Waldron, Waldron. You'll find him on Instagram and Facebook. And he does little mini webinars. His posts on Instagram are really cool. Very switched on. So I would go and see him. I think that would be my recommendation. Simon, when working self-employed, it's good to share opinions and open the mind. I think it's a lonely world, Simon, being on your own. And so I think these sort of platforms help us to have these discussions. I would far rather do this in person, so it's not my monologue. I much prefer it. So when we get let out, I'm going to invite you all to my come to my studio, and let's do this face to face. Let's have a conversation. We'll find you some local accommodation, Airbnb or whatever, or come on one of the workshops and I'll teach you some of our stuff, and we can do it. Have an evening, go for a curry or whatever you fancy, and do it then. So I'm aware it's now 10 past and you're all still here. You should all be going having your lunch or going having some fresh air. You need to go and run around the garden, run up the stairs, do some squats, go to YouTube, Biomechanics Education YouTube channel, and then also just type in squatty potty. Your kids will find it hilarious. The unicorn poo. I'm going to say no more. Go and have a look. If they're this year, Simon, I'm kind of assuming that no large gatherings are happening this year. That may be wrong, but I've had my eye on them. I don't know, because they are big maybe. Because I'm supposed to be doing one in Liverpool called Fit Expo in September. Martin, I've just trained, all done them for today, just a walk later. Good for you, Martin. Rubina, Stacy, I would recommend Rachel's I'm You Freely instructor course. Thank you, Rubina. I'm thinking, Stacy, of running another one online, or even setting a face-to-face date, because we don't need to do that one hands-on. But that would give you a series of flows, muscle energy techniques, nerve mobilizations. It's just a one-day CPD, and you get the I'm You Freely logo and certificate as an instructor if you do the face-to-face. So if you want that, anything you want from me, email me, rachel@biomechanics.education.com, or private message me. Don't message in here, because once I close this down, I think I lose all this text, don't I? I don't get this back. So yeah, so I just get the video. So if you do want anything from me, don't rely on that. Email me, rachel@biomechanics.education.com. Go follow me on Instagram, Facebook, all those places, Twitter, LinkedIn, whatever. Next week, pain science. You up for that, Brett? Bring your questions, tell your friends, the more the merrier. And then one day hopefully we'll get in a classroom. Thanks ever so much for coming, guys. Brett, thanks, mate. Thank you all, Simon. Good. Thanks, guys. Thanks, Luke, Martin, Jill, Rabina, Stacy. Who else we got? Yeah, I think I've said everyone right. They're all disappearing now. Well done, guys. See you next time. Have a good day.